The most important for the patients to realize when they're having an implant is it is an implant. It's not a permanent device like a knee replacement or hip replacement. At some point they have to be replaced. And the most common reasons are either capsule contracture or implant rupture. So those are the two things that most commonly implants need to be replaced. One of the things that the patients need to recognize before undergoing breast augmentation is what are the complications. Well, the most common complication is capsule contracture. What is capsule contracture? Capsule contracture is scar tissue of the tissue around the breast. So when you put in any implant, whether it's a heart valve or knee replacement, any implant in the body doesn't recognize it as a self. So it forms a wall of tissue around it called the capsule. Now, as long as that capsule is nice and soft, we're good. However, that scar tissue, for some unknown reasons, can become a little harder, what we call capsule contracture, contracts. And that hardness can cause some symptoms for the patient. So it is important to mitigate the formation of that capsule contracture as best as we can. And how can we do that? Well, number one, depends on who your surgeon is. As we talked earlier, it's very important to choose your surgeon very carefully. Number two, what the surgeon does in the operating room is very important. So the surgeon's skill set, how they develop their pockets, meaning that pockets is where the implant goes into, how they put the implant in the pocket. Do they use a sleeve to put the implant through it? Do they use what's called a no-touch technique? So we minimize the contact of that implant with the skin. Once patient has completed that initial phase of recovery and they're back to life activities, they have to realize that these are devices in their bodies and the devices can have issues. In addition, they have to also realize that they still have breast tissue. So those are two things they have to keep in mind in terms of going forward. So in terms of the device, they have to realize that devices can at some point have failures, either mechanical failures or cosmetic failures that may need revisions or replacement. So it's very important to follow what the FDA has recommended for monitoring these implants. On the other hand, if you have symptoms, FDA recommends an MRI. These implants are gummy bear implants, meaning that the gel is solid. We have to make sure you don't have what's called a silent rupture, where the implant is ruptured, but you're not aware of it. Number two, you have to recognize that as a woman, you still have breast tissue. And unfortunately, in this country, the numbers are 1 out of every 8 women get breast cancer. So we cannot forget that fact. And I always emphasize with my patients, self-exam, self-exam, self-exam is one of the ways to pick up early onset of breast cancer. So get used to your breasts. You know, before breast augmentation, your breasts might feel different than after breast augmentation. So get accustomed to how your breasts feel. And number two, follow the guidelines by the radiologist, which is, timing of the mammogram. So get your mammograms on time at age 40 or younger if you have a family history. So those are the two things that you have to keep in mind going forward. Again, once you recover from your surgery, don't think, okay, I'm done and I can move on. I don't have to worry about my plastic surgery. I think it's very important to maintain the plastic surgery. I know for a fact, as being one of the leaders in our aesthetic society, that most of our members love to see their patients back. Why? Because sometimes there are things that we can pick up on our physical examinations that the patients may not be able to pick up, or we can remind patients of the things that they might forget. The other thing is, it's always important to keep the information of your implant in a safe place. Just in case that you move away from your surgeon or your surgeon ends up retiring, you always know what device you have. So if necessary down the road you have to have a revision operation, the next surgeon knows exactly what you had done. But it's very important to maintain that relationship. In my practice, I like to have my patients come and see me every year on kind of annual examination, just free of charge. Just stop by, say hello, we'll look at everything. And what I do is I also take photographs of my patients. So if a patient, for instance, 5 years down the road, contact me and ask me, hey, something's changed or different, I can always go back to my photographs and say, yeah, the breasts look different and we have to work it up. So it's very important to have that kind of relationship.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.